All right, everybody, welcome. Please grab your stuff and find a seat. There are some extra seats over here. We have some extra seats laid out over here. Okay. All right. Thank you. Got a couple of seats up front in the cheap seats, we call it. Okay, we're going to get started. And I want to welcome everybody to Compass Financial. My name is Guy Lehman. I'm an owner and advisor here, and Compass Financial is a wealth management and registered investment firm. And our passion is to listen deeply into our clients' lives and walk with them along the financial journey and to provide wisdom and guidance along the way. So we thank you for coming if you're a client, and we welcome you, if you're not, to an educational event. This is something that I'm in charge of also, scheduling these educational events for clients. And this is a big one today. This is a really big one because there's a lot of changes afoot in the Medicare industry. First, I want to introduce my teammates. First, advisors, Michelle Bjorkren. Where's Michelle at? Steve Connard. Please raise your hand. Justin Van Houten. Caleb Pearson is running our AV today. Thanks, Caleb. And Alan Holstein. And our administrative staff is Julie Greer, Nancy Economist, Hannah Wilson, Joe Waniger, and Cheryl Hurst. So that's the Compass team. And again, welcome. I do want to talk about next month, because I always pump our next month's client event, and that is technology that you're likely to encounter being a Compass Financial client. Okay? And this is going to start with statements. Number one, reading statements, because there's sometimes a lot of confusion about how to read statements. So we're going to go through a statement, LPL financial statement, and we're going to learn how to read it together. We're going to talk about e-sign, because we use electronic signatures many times now, e-sign through email. We're going to talk about a note-taking software that we're using. So some of you that have had meetings recently may have been asked, hey, is it okay if I turn on our note taker? And that summarizes the meeting for us. Actually, I'm going to, as an experiment, we're going to record on our note taker the meeting that we have. And then at the end, you'll get to see what sort of output and what it heard. So it's a very interesting process. We're going to talk about how to go paperless. And that leads right into our online portal for LPL clients. It's called Account View. So getting a login, navigating around that. We're actually going to set one up new as an example. And we're going to look at secure email. And we might, depending on time, actually get into working a little bit with AI and interacting a little bit with AI as a group. So, and then we have December off because we have our Christmas, the first Thursday of December, Christmas party. And in January, we're going to have our annual economic update starting in January. So that's what's to come. Today, however, we have Christy Klein with KHI. Compass has had a long time association with KHI. They've been friends at Compass for a long time. We've invited them in several times over the years to give this presentation. And we have a lot of faith and trust that when we give our clients some names of Medicare agents that we like and that we trust to work with, that we always get good feedback when people go with KHI. So today, Christy Klein, take it away.
Thank you so much, Guy. Can everyone hear me? How's everyone doing today? Yeah, good. Okay, lively bunch, unlike my last bunch. Thank you so much, Compass, for letting us come in and talk about Medicare health insurance. We are your health insurance experts. We love to talk Medicare. I can talk it all day, but I know you guys have limited time. So, but again, thank you for having us. Thank you for being here. I'm going to go through the locations that we serve. Our home office is actually in Fort Dodge. We started in Fort Dodge back in 1965, so you've got over 60 years of experience with KHI. My office, we just moved to Grimes. We were in Johnston. Before that, we were in West Des Moines. But we just went to a beautiful new building right off the 141. If anybody knows where the Hicklin Motorsports is, just north of the Toyota, we're around the corner from them. We've had a big, beautiful space, and happy to help. We also have an office in Arnold's Park. So if you know somebody in Iowa, around the state, we're able to help. We actually even have some of our agents, we are licensed in other states. So if you know a family member that needs help, we are absolutely happy to help. So let's meet our team. It's not just me, let me tell you, there's too much, there's too many of you and not enough of me. We've got a whole team. So really first would love to introduce our co-owners. Like I was saying, that we've done these seminars for years, and it's usually Lynn Schrader, who's out of our Grimes office, who does this. But as she's getting older, she's trying to back away, so they've let me do the presentings. I'm happy to do, happy to do it. But Lynn Schrader is out of our Grimes office, and then Brenda Eckert is in our Fort Dodge office, and so Brenda handles everything Fort Dodge. They took over in 2018. From the original owners. It's kind of passed a couple of times, but to know that they've been doing this for a very long time. Lynn used to work for Wellmark back in the day, and Brenda's been working at KHI since 1993. So great, wonderful team, wonderful women owners. And again, my name is Christy Klein. I'm your official presenter. I am a Medicare specialist, but I can also help people in the marketplace space, better known as Obamacare, the Affordable Care Act. Pick a name, but we can do it all in our office. But like I said, there's not just me. We've got a team of women to help out. Yes, we're mostly women. We do have one gentleman in our Fort Dodge office. He's behind the scenes. It wasn't meant to be that way. It's just kind of how it's happened. But we've got some really strong people to help. So Melanie is in our Fort Dodge office. She is our team leader. She's got Julie, Mika, Angie, and Alexis in Fort Dodge, so a very big team in Fort Dodge. Tiffany down in Grimes, she's with me. So if you don't talk directly to me, you might work with Tiffany. Trust me, she knows what she's doing. I trained her. And then we've got Allison up in Arnold's Park. And then besides that, we even have more team members. We have support team. So we've got Kim in Fort Dodge that supports all the girls in Fort Dodge. We've got Deb here in Grimes that helps Tiffany and myself. And then we've got Sam in Arnold's Park and who helps out Allison. So questions we're going to go through today. And I'm easy peasy. We'll pause, we'll take questions, but we're going to go over eligibility. We're going to go over the parts and the costs of Medicare. Enrollment. What if you want to delay Medicare? How do you do that? What does Medicare cover? What don't they cover? How do you cover that? How do you fill the gaps? And again, like I said, we'll leave it open for Q&A at the end, but we will take questions in the middle. When I became a presenter, one of the things I learned is know your audience. I'd like to get to know you just a little bit. How many of you here are already on Medicare? That's a pretty big part. Yeah, awesome. How many are here because you're going to be 65 in the next year, 2, 3 years, or maybe you're here to learn for somebody else? Awesome. Okay, great. So we're going to go over all of that fun stuff for you. So let's dive in. Who's eligible for Medicare? So if you are a U.S. citizen or a permanent resident for at least 5 years and you're 65 and older, you are eligible for Medicare. Now, you might meet some people who are under 65 who are on Medicare. Well, how is that possible? Well, if they've been on Social Security disability for at least 24 months, they are given Medicare. Or if they've unfortunately been diagnosed with end-stage renal disease, ALS, or have had a major transplant, they would also be eligible for Medicare. So we'll go over the different parts of Medicare. So when you go on to Medicare, you get a wonderful card that looks like this. We call it the red, white, and blue card. You will get a card like this, and it has your name on it and a funky numbers and letters, and it says Part A and Part B. And you're like, what are all these letters? Medicare likes to play the alphabet game. So Part A is for hospitalization. If you went to the hospital, Medicare would file the claim under Part A. And if you went to skilled nursing, they would file that under Part A also. Skilled nursing is usually you've been in the hospital, you're really ill, you're they want to kick you out of the hospital bed because they need the bed. Yeah, you're somebody shaking your head, yes. So they send you over to skilled nursing to get stronger, to get better. So Medicare Part A will cover that too. And then there's hospice care. Medicare will pay for the hospice care. Now, most people do not pay for Part A premium because you've already paid for Part A, or you are right now paying for Part A. If you look out of your paycheck, look out of my paycheck, your guys' paychecks, you're paying for Medicare. So you've already paid for Part A. So you shouldn't have a premium. If you've worked, you or your spouse have worked for, it comes out to about 10 years. Medicare says 40 quarters. Of course, the government's got to make it a little bit difficult to figure out, but we figured it out for you. It's about 10 years. So we rarely ever meet anybody that needs to pay for Medicare Part A. But like we said, eligibility, if you've been in the country just for 5 years and you're 65 or older, you might become eligible for Medicare. Those people would then have to pay Part A premium. This year, it's $518 a month. It's quite expensive. But like I said, I rarely meet anybody that has to pay for Part A. So then there's Part B. So what does Part B cover? Well, this is where most of our claims fall under, because Part B is going to your doctors and your specialist. And that's what we do most of the time in the year. We're going for our preventative services, or maybe we see a specialist a couple of times a year. So they would bill that under Part B. If you had an outpatient surgery, that also falls under Part B. And let me tell you, they're doing a lot of things outpatient these days. I just talked to a client. He's getting a pacemaker, and it's outpatient. Really? Outpatient for a pacemaker. But yeah, that falls under Part B. And then durable medical equipment. So if you have, maybe in the future, you might need a wheelchair or an oxygen or CPAP machines. Lots of clients come into my office and they are on a CPAP machine. That also falls under Part B. Or if you're insulin diabetic, maybe you have an insulin pump, or maybe blood glucose monitors that people wear now that are hooked up to their phones. That also falls under Medicare Part B. Now, Part B does have a premium, and the minimum premium this year is $185. We'll go into how that premiums work in just a minute. Most people get in trouble with penalties when it comes to Part B, because they don't get their Part B when they should, because they're delaying Medicare. And again, we'll talk about delaying Medicare. But you want to talk with a specialist that knows about Medicare when you're delaying Medicare so that you don't end up with penalties. And you never want to lapse in your coverage. I've talked to 2 clients in the last few weeks, and they were changing jobs and they had a lapse in their coverage. They were over 65. They now are going to be part of this penalty. And this penalty is lifetime penalties. Again, this is how Medicare pays for Part A and Part B. So again, we're going to talk about the costs of Part B. So Medicare and Social Security actually work hand in hand. They're 2 different departments in the government, but they work hand in hand. And Medicare and Social Security decide how much everybody's going to pay for their Part B every year. And to try to make it fair, what they do is they go back 2 years on your taxes. So for 2025, you'll notice right here in the corner, says they're looking at your 2023 income. So they always go back 2 years, because not everybody files their taxes. I've met some people who are just now filing their 2024 taxes. So they'll go back on your taxes 2 years. And then you need to find which column do you fit into. Do you file married and file jointly? Do you file single? And then how much did you make 2 years ago in 2023? And then depending on how much you make, you go over to the last column, and that's what you have to pay. Everybody has to pay a Part B premium. And again, this year it's $185. If you made more money 2 years ago, you pay into IRMA, the Income-Related Monthly Adjustment Amount. It's unfortunate that you're a higher earner and you've done well in your life, but you do have to pay more into Medicare. A lot of people forget that they look back 2 years, and this chart will change every year. So for 2026, we don't have the chart yet for 2026. They haven't released it, but they'll look at your 2024 taxes. And sometimes some of our clients, they never pay IRMA, and then 1 year they get a letter from Social Security, because Social Security will notify you at the end of every year what your Part B premium is going to be. And we've had clients call us and say, I'm getting IRMA all of a sudden. And we go, okay, so what happened 2 years ago? Well, we live in Iowa. A lot of times, family farms, and then it doesn't, and they sell it, and then there's an inheritance or some kind of a profit there. They forget about it, and then Medicare remembers because they look back at your the Social Security and Medicare look back at your taxes from 2 years ago. If it is for you to have high of an income, you can dispute the IRMA with Social Security. They are going to look back at all your tax returns for several years, but we are hearing that they're being a little bit more reasonable, and I've actually heard of a couple of clients getting their IRMA changed because it's not normal for them to have that much money, and they can't afford to pay their IRMA prices. But again, Social Security will send out, if you're currently on Medicare, which a lot of you are, Social Security will send out your letters end of the year. So how do I enroll into Medicare? So like I said, Medicare and Social Security work hand in hand, and to actually get your Medicare card, you actually go through Social Security. If you're already taking your Social Security benefits, which is fine, you can do that. If you are, you're already in Social Security's system, and so they know when you're turning 65, and they'll automatically send you a card. They'll send you that beautiful red, white, and blue card that has your name on it, and it'll say Part A and Part B. Also, if you were part of the Railroad Retirement Board, I have yet to meet anybody from the Railroad Retirement Board, but that happens. So they automatically get their Medicare card. And their Medicare card will come about 3 months before your 65th birth month. Now, if you're not taking your Social Security benefits, which is perfectly fine, work with your financial advisor is what I always say. Just decide when you need to start taking your Social Security benefits. If you're not, then you're just going to go to Social Security's website and apply for your Medicare Part A and B. It's really easy once you log in. I think the hardest thing is if you've never created a Social Security account, I suggest do it sooner than later so you're not fighting it. They have made it a little bit harder to make an account online. But once you get in there, you click on, I need to apply for my Medicare card, and it takes all of 5 minutes. So when do I
Misty,
apply?
I have a quick
Sorry,
question.
go ahead.
Will you go back 2 slides?
Sure, absolutely.
Okay, on the IRMA one.
Oh, on the IRMA?
Yep. So the question we get a lot is, hey, I retired this year and my income went way down, but they're looking back when I was still working. What's the process there?
Again, you'll get the letter that you have to pay the IRMA. If you go into a couple of pages, it does say how you can dispute it with Social Security. Okay. But most of the time, those kind of things, don't usually reverse.
So you got to take it on the chin.
You got to take it on the chin.
The first couple years,
yep.
If you're a higher income earner.
And then it'll come down eventually.
Okay.
Yep. And these numbers and the charts change. We do expect it to maybe be up to close to $200 a month this next year, but I don't have any official figures yet. So when do I enroll into Medicare? So actually you get a very large window of 7 months. So you've got 3 months before your 65th birth month, you've got your birth month, and then you've got 3 months after in case you missed it. So right now we're October, so we're actually talking to January birthdays right now. Sometimes even February birthdays. But they give you a nice big window. Earlier, I had talked about Social Security and Social Security benefits and going through Social Security to get your Medicare card. I'm going to give you a little bit of advice, what I've learned working with the government. Within Social Security's building, there's 2 different departments, one that handles Social Security benefits and one that handle Medicare cards. They do not talk to each other. Big surprise, right? They have old antiquated systems. I think that they might still be on DOS. But yeah, they don't talk to each other. And when you're ready to go into Medicare, a lot of people are ready to also get their Social Security benefits. They don't want to wait till they're 67 or whatever, however long that they can wait. They need it right away. My advice to you is if you need those benefits when you're turning 65, apply for them well in advance before that 3 months before your those 3 months before your Medicare birth month. Because what happens is we have lots of people who apply for their Social Security benefits and their Medicare card at the same time. And here in Iowa, what happens is that their applications get sent down to Kansas City. And I think there's 2 guys in Kansas City that work those. And it takes clients weeks and weeks and weeks of calling to try to get it straightened out and get their Medicare card. And we can't help go further with where Medicare leaves off and help you with the gaps until you've got that Medicare card and number. We have to put those on applications. So if you can wait until you get your Medicare card, then apply for your benefits, or hopefully you're working in advance. That's why you're here today, to learn. Apply for your benefits ahead of time, get those rolling up, then apply for your Medicare card. I'd hate for you to be one of those people last minute, we're down to the last day of the month, trying to get your Medicare number to help you get a gap plan. Now, hey, Christy, I'm not ready to go on Medicare. I'm still working. My spouse is younger than me. I'm carrying my spouse on my insurance. What can I do? Can I delay Medicare? Absolutely, you can delay Medicare, but you have to meet Medicare's requirements. And there are 2 requirements you have to meet. You or your spouse must be actively working. Actively working. You're earning a W-2, you're earning a 1099, you are actively working. And then the second thing is you have to make sure that your coverage is what Medicare bounds creditable. And I'm not going to go into all the rules. I honestly don't even know all the rules. I'm not a lawyer to read everything, but I do know creditable is around your prescription drugs. And how would you know? I don't know if my plan is creditable, or I have Wellmark, I know it's creditable. Oh, I work for a really big company. I'm going to say nay to all of that. It doesn't matter if you work for a big company. It doesn't matter if you're on a Blue Cross Blue Shield or Aetna or United Healthcare. They all have plans that Medicare deems not creditable. So go to your HR department and ask them, I'm turning 65. I want to delay Medicare. Is my plan creditable? And every year you're going to delay, you need to make sure every year it is creditable. We are hearing in the market, because the employer has to pay a little bit extra to be creditable, and we're finding out that a lot of these costs are up next year and employers can't afford it, or they're not going to afford it. So it's going to force people to go to Medicare. So make sure every year, and I've had clients that they delayed Medicare into their 70s. They worked, they got their insurance, it was creditable every year, and they waited to go on to Medicare in their 70s, which is perfectly fine. You can do that. Just make sure every year. If it's not creditable, you're going to end up with one of those penalties, and again, those are lifetime penalties. What happens is when you delay Medicare and then you're ready to go on, however many years later, you have to prove to Medicare and Social Security you had creditable coverage. Actually, your HR department's going to fill out a form. We've got those forms in our office. We send them to you. You pass them on to your HR department and get them back to us. But if you don't have that creditable coverage, and if you don't have seamless coverage, I said before, I've had a couple of clients, they had a lapse, they're going to end up with that penalty. And please note, after age 65, COBRA is not creditable coverage. Because I've had a lot of clients call me and go, oh, I'll just take COBRA. They offered it to me. They had to offer it to you. But Medicare rules trump all of that. So you need to go on to Medicare. If you go on to COBRA or a retiree plan, or maybe if you're a veteran, thank you very much for your service, appreciate that, but VA benefits is not what Medicare considers credible. You've got to get your Part A and your Part B. We really don't want you to end up with penalties. When in doubt, call our office, let's go through it, because everybody's situation's a little bit different.
Can you review again quickly what that penalty is?
It's about a 10% penalty every month. I don't know exactly how they figure out the penalty.
So you're going to pay higher premiums for the rest of your life.
For the rest of your life. It's going to be an additional penalty premium on top of everything else.
Okay, and then that's for not maintaining creditable coverage at some point prior
or having a break in your coverage.
Okay. What you talked about the 7 months to sign up for Medicare.
Mm-hmm.
What if it just blows past?
And if you didn't have creditable coverage and you weren't actively working, you could end up with a penalty.
Okay. All right.
So some people, when they are going to delay Medicare, they at least sign up for their Part A. Because again, Part A is premium free. Why not get extra coverage if you ended up at the hospital? And actually, we would say, yes, do that. Get into Medicare system. And then when you're ready to go on to Medicare, getting your Part B, it makes it a little bit easier. However, there's another caveat to that. If you and your employer are contributing to an HSA, a health savings account, a health savings account is something that you usually have when you have a high deductible plan. And it's a savings account that you can add money to, and you can keep it and continue for years after you're done working and you can use it. But HSAs are pre-tax dollars. And earlier I said Part A is premium free. The government says you can't double dip. You can't have two benefits. That's too much for you. So if you are contributing to an HSA and your employer is contributing to an HSA and you're 65 or older, you don't want to get on any parts of Medicare. You don't want to get on Part A. And when you do want to retire or come off your group plan and you want to get onto Medicare, you and your employer have to stop contributing up to 6 months prior to going on to Medicare. This is also where some penalties, I wouldn't say big penalties come in, but penalties, and it's usually when you're filing your taxes because the government, again, oh, you had something Part A, Part free, and then you were also contributing, we're going to take some money from you. And we don't want that to happen. Yeah, question in the corner.
Hold on a sec. Got to do the mic for the people online.
Oh, mic online.
Well, I'm planning on going on Medicare January 1st. I'll be retiring at the end of the year, but I'm on an HSA right now. Are you saying the 6-month window
This
is going
is
to
past age 60, 65 or older.
Okay. And I'll be 65 in December though. Does that?
You should be okay. 65 in December is fine. But if you're going to work past age 65, you want to delay all Medicare if you want to contribute to your HSA. We had another question right there.
Hold on, an additional question. So he's going to turn in December, and let's say he works another year to December next year.
Then he doesn't want to get on any part.
Doesn't want to get on any part.
And then you need to stop contributing to your HSA 6 months before. So if you wanted January of 2027, you need to stop contributing June of 2026.
Okay, but he would still have to sign up for Part A?
No.
So hold on. Back to the prior question that I had. If you miss signing up for A.
No, that was Part B.
Gotcha.
Oop, went back the wrong way.
So you do not have to sign up for A.
You do not have to sign up for A.
When you turn 65.
When you turn 65, you can if you're not contributing to an HSA.
Okay.
If you're going to delay Medicare, delaying Medicare is usually delaying Part B.
All right.
Does that clear as mud?
Next question.
I'm going to be 67 in February. I'm still working. I have an HSA. I was planning on getting on Medicare this year. So I'm almost going to have to wait another year if I'm going to have penalties.
Or you stop contributing now, count it out the 6 months.
So when we're doing our renewals in November for our benefits through work, I should just basically not take the HSA and then sign up later for Medicare.
You could do that. Yeah, you could look if your company is offering you another plan outside a high deductible plan. Yep. Yep. It gets tricky after age 65 and delaying Medicare and HSAs. But yeah, we're happy to sit down and go over those different options with you. I have given a handout that we have for, and I'm on the wrong screen, for HSAs and Medicare. I didn't bring it with me, but I know I've given it to everyone here at Compass Financial, or you can give me a ring or an email and I'd be happy to send it to you just so that you have it and everything's spelled out for you. Any other questions on delaying Medicare and HSAs? Okay. So when you delay Medicare, Part A and or Part B, and then you're ready to go on to Medicare, would you get a special enrollment period or a life event? And I'm not on the right screen. Sorry, apologies about that. You would, I was on the right screen. I apologize again. But you would get a special open enrollment for whenever you decide to retire and come off of your group plan. So some clients like to do it at the end of the year and start Medicare brand new for January 1st. I'm actually working with about 20 clients right now. They either got their Part A or maybe they didn't because they got an HSA and they stopped contributing in June. Now I'm helping them get their A and or B. And we've started the paperwork into Social Security, and we're asking for a January 1st start date. Because everything, once you go on to Medicare, starts over. Any deductibles, your premiums, everything like that. So a lot of people like to start Medicare at the top of the year and when they're working and delaying Medicare. But let's say you're a school teacher. I work with a lot of school teachers. They're they're going to work through until maybe the summer, June or July, and then they want to retire. Absolutely, you can do that, and then you've got a life event to get onto Medicare, get your Part A and or B, and then get on to a supplement and other plan. So we're there to help you with that. So you can do that. The clock does start ticking. Again, we want to make sure you have seamless coverage. We don't want you to have a lapse in coverage because we don't want you to have any type of penalties. And then there's other things to consider when you're going to go on to Medicare. Are you carrying your spouse on your group insurance? And a lot of times you are maybe carrying a younger spouse, and that's why you're on your group insurance. So that might be a reason why you work a couple of more years and you delay your Medicare. But what if you don't want to, or your company's saying, we really want you to go on to Medicare, or maybe Medicare's cheaper. There's been times where we've priced everything out and Medicare might be cheaper. But what's your spouse going to do? Well, if your spouse is not 65 yet, they could go on to COBRA, or if they're work for a small company, you might go on to Iowa. Again, there's the Affordable Care Act plans. There are short-term care plans out there. There are other options to explore, but let's have that conversation about you and your spouse, or is your spouse also working and maybe they can get their own insurance through their own employer. So I'm ready to go on to Medicare. I'm turning 65. I'm ready to retire, or I've already retired. I'm ready to get on Medicare. I've signed up for my Part A and Part B, or maybe it's cheaper. So I'm going to go on to Medicare and get my Part A and Part B. Well, how much does Medicare A and B cover? Well, it only covers 80%. So you have the other 20% to worry about. Now you could stop there. You could just have your A and B and be responsible for 20%. But let me tell you, 20% of a hospital bill, and in 2022, I had a catastrophic year. I was in the hospital 3 different times. I saw one of the bills that accidentally came to me without running through insurance. My husband opened the envelope and almost fainted. It was $97,000. If we would have been responsible for 20% of that, that would have totally wiped us out. So let us help you with the other 20%. Medicare also has a Part B deductible. It's $257. It's a pretty small deductible, but we can help you get that covered. And then there's also excess charges of 15%. Several years ago, we weren't seeing excess charges being used, but since COVID, we are seeing doctors, hospitals, clinics, and where you get your durable medical equipment, they're starting to charge those fees. So let us help you get the coverage for everything you need. And also, original Medicare, A and B, they're not going to cover your prescriptions. They don't cover dental, vision, hearing, gym memberships. And you hear all those commercials about all of that stuff. What can we do to get all this coverage? So this is really where our team definitely comes in to help you, is to help you fill those gaps. We're going to help you with everything else, but this is where we really shine, is helping you fill the gaps. And you've got a couple of options. So your first option is to go with a supplement and a Part D drug plan. For those of you that are already on Medicare, are several of you on supplements and drug plans? Awesome. Okay, awesome. So for those of you who don't know what a supplement and a drug plan is, let's talk about it. So a supplement is just that. It supplements the other 20%. Medicare Part A or Part B is going to cover your first 80%, and your supplement's going to cover your other 20%. A supplement, you're going to pay an upfront monthly premium. And as long as you're paying that premium and Medicare paid the first 80%, you're pretty golden. Now the supplement companies, there's all kinds of companies out there. all kinds of, people that they want your business. They're going to call you. Or when you turn 65, the mail is crazy, right? You guys get so much mail. It's your political season when you turn 65. But we are brokers. We contract with many companies. We stick with the A-rated companies that we know pay their claims and everything and have best rates. But there are going to be different plans that you can pick with a supplement. So Medicare plays the alphabet game, and the supplement companies thought it'd be funny to do it too. So they also play the alphabet game, and they have plans D and F and G, K, L, M, N. What are all these different plans? Well, some of you, or maybe you knew people that were older than you, they might be on a plan F. It was a very popular plan. It covered everything that Medicare didn't cover. They closed the gap on plan F. So if you're on a plan F, you can stay on your plan F, but people who are 65 coming into Medicare, they can't get a plan F. The best plan we can get them is a plan G. And the only difference between the F and the G is that Part B deductible. And this year it's only $257. That's a pretty small deductible compared to our group deductibles. I don't know about you guys, but I got like a $7,000 group deductible, so pretty expensive. But if you've got, again, Medicare, you've got your Part A or B that covers it, you've got your supplement, maybe you got your plan G, you're going to pay the $257, you're going to pay your monthly premium, you're pretty golden. Now, when you first get onto a supplement, you can get on any supplement you want, and there's no underwriting. You get to pick whatever you want. And some of our qualifying questions are going to be about your health. We want to know, how is your health? What are you doing? And we take notes of that. And we want to make sure that, because sometimes this is a pretty big decision. If you're had cancer before, Parkinson's diagnosis, or something, catastrophic, maybe you've had a stent or something, it might be very important of which supplement plan to get you on, because you might be married to that for the rest of your life. Now, some of you go onto a supplement and don't have a lot of health issues. Maybe you want to change your supplement, because one of the downsides to a supplement is your premium will increase year over year. Supplements are age-based, so they are going to go up year over year, and it's usually around your birthday. But then sometimes companies, they didn't make enough money, they paid too much claims, they might charge, or they might do a price increase in the middle of the year, or maybe at the top of the year. So you might get a couple increases in a year. So that's the downside to the supplement. So when you're on a supplement, maybe 10, 15 years go by and your supplement keeps creeping up every year, and you're like, oh my goodness, this supplement's really expensive. What can I do? At that time, if you can go through underwriting, you may be able to change your supplement plan and find a different. Same coverage, same plan F, same plan G. Maybe you went with an N or an L or a K, but we can find you another plan, but you would have to go through the underwriting questions. The underwriting questions are just, it's a series of health questions. If you can answer no to all those, they'll go to an underwriter, but they will pull your information from your doctor for the last 5, 10 years, see if you can underwrite. So some people can't underwrite. If you've ever had a stent, if you've ever had AFib, if you've ever had a heart attack, a stroke, a cancer diagnosis, every company has different underwriting questions. That's something that we watch for, and we watch which companies will pass underwriting. But again, some people, when they come in, they know that they're going to be on their supplement plan for the rest of their life. So it's a very big decision. So we look at all those different things for you. I think we're going to pause for a question. Oh, 10 minutes left. Oh, I better hurry up. I'm sorry. Did you have a question in the back? The increases that happen year over year, it's usually age-based, and they're looking at everybody that they have in your county or your state. Now, with that, you need to get a Part D drug plan. And a Part D drug plan is going to be a different company. It's going to be a different premium. They're going to have their own deductibles. But pretty much what we do is we ask for your prescription drugs, and we plug it into the computer system, and we find which drug plan is best for you. What's nice about this is your drugs can change every year, so you can change your drug plan every year. Open enrollment's right around the corner. Next week, actually, October 15th is open enrollment, and it's for people to change their drug plans. Again, you don't change your supplement plan because you have to go through underwriting, so it's really about the drug plans. And this, again, is where sometimes people get in trouble with penalties because they don't get a drug plan. I'm not on any prescriptions. I don't need a Part D drug plan. And my answer to that would be nay. Yes, you do need a Part D drug plan. Now, there are very cheap drug plans out there. This next year, we've got drug plans that are $4 and $5. And it's for those people who are very generic drugs or don't take any prescription drugs. Now, I talked about the IRMA on the Part B. If you're paying it on the Part B, you're also going to pay it on the Part D. Because again, this is where Medicare makes their money and all of that. One good thing that came into law last year for customers was there's a maximum out of pocket now on Part D drug plans. Before there was the donut hole, and you might have heard about that. And the donut hole is you would maybe sometimes pay out of pocket $5,000 to $8,000 out of your pocket for drugs. And one law that went into effect now caps drugs at $2,000. Next year, it's going to cap it at $2,100, which is good for people on very expensive drugs or specialty type drugs. But the insurance companies are being smart to the law, and they've got lots of lawyers. What they now are doing is they're not covering every single drug in their formulary. And so the law says if your drug is in the formulary, then you're capped at the $2,000 or the $2,100. But insurance companies aren't going to cover all 20 insulin drugs that are out on the market. So again, you have somebody look over your drug plan every year. If you've already got an agent, make sure they're doing your drug review year over year to make sure that you're in a plan that's covering all of your prescriptions.
I would double that. I would say that's critical because every year, and I've seen these charts that, let's say this year, your plan partners with Sam's Club Pharmacy. So you can go to Sam's Club Pharmacy and get your medicine for $18 a month. But if you happen to go to your Hy-Vee that's right next door, it's $390 a month. And you just never know that because all this stuff changes every single year. There's a bunch of changes going on, so you got to look at it every year. And if your agent's not doing that stuff for you, you got to find someone that will.
Yep. And if we can't help you, there's pharmacists that will help you. There's also SHIP, which is senior health insurance planners. Every town and every city across the United States have SHIP. And there's usually retired agents who used to do what I do, and then they can help with Part D drug plans too. So your next option 2, is an Advantage plan. So we originally just talked about you've got A and B that cover 80%, you got your supplement covers the other 20%, and you got a drug plan. We all carded it, put it together. Now your other option is an Advantage plan. What an Advantage plan is, it's a package deal. Everything we just talked about, your A, your B, your supplement, your drug plan, all in one package. Medicare says, hey, insurance company, you offer this Advantage plan. We approve it, we have to approve it, and whatever you offer has to be as good or better than what I offer. And the insurance companies, yeah, we'll do that. So we'll offer some plans. Now, how the Advantage plans work is instead of paying an upfront monthly premium, it's pay co-pays as you use the insurance. So if and when you go to the doctor, that's when you pay your co-pays. It's pay as you go instead of paying up front. So a lot of people like that because they're very healthy and they only go for their preventative services. And on an Advantage plan, they can save a lot of money. But you're going to have a catastrophic year, just like I did in 2022. Happens to us all, unfortunately. As you pay co-pays all year, these Advantage plans have maximum out-of-pockets or ceilings, so you can't spend too much. So a lot of them this year were around the $4,000 range. We're seeing them go up to $5,000 this next year. It does vary by the county you live in. So what we have available here in Des Moines is going to be different than my counterparts up in northern Iowa or even around the country, which you hear in Florida, your friends in Florida, they got some pretty rich plans down there. But there's a lot more seniors down there. But that's those commercials you hear. Call us and check your zip code. Please don't call those numbers and check your zip code. Please call us. We're happy to check your zip code and check these Advantage plans for you and see if they work for you. Again, I said that the Advantage plans have to be as good or better than what original Medicare offers. These plans, a lot of them offer drug coverage. So again, to help you avoid the penalty. Because it offers a drug plan in it, you can change your Advantage plan every year. So if you went with United Healthcare one year, maybe next year Aetna's got a better plan, or maybe Wellmark's got a better plan. Mercy One has a plan that's really good this next year that I'm looking at. So it's really nice you can change your plans every year because it has a drug plan in it. Now, Advantage plans, they come with HMO and PPO plans. HMO plans is how the We're very restrictive. And that's got to, because if you went out of network, who gets the bill on an HMO? You do. So if you're going to be on an HMO, a lot of the HMOs give a lot of extra benefits and they're very enticing, which is fine, but you need to make sure your doctors and hospitals, clinics are all in network. PPO plans allow you to go out of network. We have a lot of customers, they go down south for the winter, Arizona, Florida, Texas, California. We try to put them on a PPO plan because if they accidentally go out of network, then you're only going to pay 40% instead of 100%. That sounds a lot better, doesn't it? Yeah. And what's nice about these Advantage plans is there's never any underwriting. So customers, they might start out on a supplement plan because they like the supplement plan, they like to pay that premium every year. But I said the supplement plans, the premiums go up every year. And if you're paying $350, $400 a month and you can't underwrite to another company, maybe it's time to look at an Advantage plan. Because again, Advantage plans have maximum out-of-pockets. $5,000, if I divide that by 12 months, we're looking at around $400 a month. Are you paying more than $400 a month on your supplement plan? Maybe it's time to talk about an Advantage plan. And the Advantage plans do come with the extras. These are what's very enticing when you hear on these commercials. They come with dental, vision, hearing, gym membership. So that's sometimes why some of my clients might even change their plan. Hey, I know I'm going to have a root canal next year. Christy, find me a plan that's got the most dental on it. And make sure my dentist is in network. And sometimes it's very important for gym memberships. Now, a lot of these plans this next year, we're noticing they're coming down on these extra benefits because of the changes in the market. So that can happen. Your co-pays can change every year too.
Would you go back a screen, please? This, go back another one.
One more?
Yep. Right here. This is what has attracted a ton of people to go onto these plans. Enormous growth in these Medicare Advantage plans.
More than 54% of Americans are now on Advantage plans.
Probably quadrupled from 5-7 years ago.
Yeah, it's absolutely.
Okay. So what's happening here is the government is paying the company, insurance company that's running these plans to care, to be in charge of your health care. Okay. Now, some of companies have gotten in trouble. United Healthcare specifically has gotten in trouble for sending nurses out to people on their Medicare Advantage plans and finding healthcare issues. Therefore, they can turn around and charge the government more for an unhealthier client. Okay. So there's some inherent issues in this, which is why I think you're seeing some changes in the marketplace, because those issues are being brought out into the open, a light shined on them, and there's some changes that they're saying, oh, we can't offer such a rich plan anymore when the client is paying zero. So we're going to take away a few of these benefits.
Yeah, and some of them are starting to charge a premium. It's $38 a month. It's pretty inexpensive, but we will probably start seeing that more and more in the future with the Advantage plans. But the Advantage plans aren't going away. Medicare approves them. Medicare likes them. Medicare can't do all the claims that they have right now. And the big insurance companies, they can do the claims and they can offer the Advantage plans. So they definitely do. And a lot of clients, they're very, very popular, especially with these extra benefits. So if you think maybe an Advantage plan might be something to look at, let's sit down and let's talk about it. I mentioned earlier about open enrollment. So open enrollment is upon us next week. And this is for clients who are currently on Medicare, and they can make changes for their Part D drug plan, or again, their Advantage plan that has a drug plan in it, they can change their Advantage plan. If you are somebody that wants to talk to me about your Medicare, I'd be happy to, but if you're not turning 65 until like February or March or April or even a year down the road, could you please wait to talk to me in January? I ask for your patience because there's so many more clients than there are of us, and we have a short 7-week to get everybody done, and we work around the clock. This is our tax season, and or our political season, because all of the commercials and the mailers and the knocks on the door. But we would happy to help you if you've got something future. But if you're currently on Medicare and need help, absolutely, we're going to fit you in. There's also a second open enrollment a lot of people don't know about. It goes from January to March, and it's for clients who are on Advantage plans. They get a second open enrollment to change their Advantage plan from January to March. So a lot of clients, sometimes they'll just wait and see, or they know that it's hard to get in to see me, so they'll wait till January, February, or March to maybe make a change. But the government gave this second open enrollment. Again, it's because sometimes doctors don't stay in the network with the Advantage companies, so then you might need to change your Advantage plan so that your doctor is in the network. So that's another reason that they give that other opportunity. So summary, real quick. In summary, you can get just your Part A and B and nothing else, not what we suggest. But there are people out there. And be careful that if you didn't get a Part D, you might end up with a penalty. Government will catch up to you sooner or later. We say your options are number 2 or number 3. Get a supplement and a Part D drug plan, or get an Advantage plan. Invite you again. This is our email address and our main office number in Grimes. I'm more than happy to contact me, email me. Hey, Christy, I saw you at the seminar. Want to sit down, make an appointment. Hey, I'm not turning 65 for another 6 months, so I can wait till January. Appreciate that. But we're there to help. Again, I might give you over to Tiffany. She might help you, but we're there to help. I also left some cards on the front table. You're more than welcome to take one of my cards. And then we'll leave it open for questions.
Yeah. Okay. I'm going to start with a question.
Sure.
So from a big level, broad perspective, what's changing in the marketplace this year?
The biggest changes we're seeing are less drug companies, Part D drug plans, or might be some companies that stayed around, but instead of offering 3 plans, they might only offer 1 plan now. So we're seeing a lot of that. And then in the Advantage space, a lot of the companies are dropping some of the extra benefits. So they've done research in the last couple of years, like on the silver sneakers. Well, only 17% of our members are using silver sneakers. We're going to drop silver sneakers. So that's what we're seeing as some of those type of changes. And of course, costs just going up, premium increases.
I have heard, and tell me if this is your initial experience, that I heard one Medicare agent talk about he expected 50% of his clients to have to change something this year.
There are, again, Advantage plans are by county, and Wellmark, Aetna, United Healthcare, they are dropping some of their counties,
Okay.
so they have to make a change. Or on a Part D drug plan, again, maybe they're going from 3 plans to 1 plan, and that company isn't crosswalking them to that plan, so we do have to make a change for those clients. So we put those clients at the top of our list because we know they have to change.
Gotcha. And then in addition, what's the percentage of people that you see every year being on Advantage plans versus the old traditional Medicare plan?
Myself, I probably have 8 out of 10 client Advantage plans.
Okay.
Here in Des Moines.
So
But if you ask my counterparts in Fort Dodge and Arnold Park, they would say it's the opposite. They have 8 out of 10 on supplement plans. But because of the changes with Advantage plans, I am hearing more of my clients ask, can I go back to a supplement? And the answer is yes, if you can pass underwriting.
Okay. So switching from traditional Medicare plan to an Advantage plan, there's no underwriting.
There's no underwriting. It's a lot easier.
But switching back, there is underwriting.
There is underwriting. So a lot of people say, oh, it can't be done. No, it can be done if you can pass the underwriting.
If you're relatively healthy.
Yep.
Okay. Open it up for questions. We got about 5 minutes here. If it's something really specific to your case, I guess I would say come up and talk, ask the question afterwards, but big, broader questions about what's happening, where we're going. So cast the line a few more years down the road. You just see more of the same?
I hope so.
Prices going.
I hope that we're still around the next couple of years, and I hope that everything stays the same. And I hope that the price ends and the gouging kind of end a little bit after 2026. I think we're seeing catch up from COVID. I think we're seeing catch up with the Part D drug plan changing, the capping at the $2,000. So we're kind of hoping that 2026, 2027, things calm down. Our hope.
You see what's the average price increase this year? that you're
With
seeing?
supplement plans, the price increase, I've seen anywhere from 12 to 22%, depending on the company.
Okay. And Advantage plans typically,
Advantage plans, I'm seeing like 10% or $10 increases with the with the copays. Like a specialist used to be $40, maybe now it's $50 or $60. So maybe a 10 to 20 different price. And it's not every copay that gets changed. They pick and choose which ones.
this kind of reminds me of a time, and most of us were working at the time. You guys remember high deductible healthcare plans when they first came out? Their premiums were very small. It was very affordable because the idea was that you were taking a bigger risk with a bigger deductible. Okay.
Online question.
Online question.
Nice.
What would I'll come back to that idea. What would be the reasoning on why a person would not go on Medicare at age 65 and stay on their company plan? It just doesn't seem like there would be any reason based on the commentary.
One of the reasons might be they're carrying their spouse and their spouse is younger and not able to go on to Medicare. Another reason might be cost. I have talked to several people where Medicare is a lot more expensive than their group plan, but then I've seen it the other way around. So there are a couple of different reasons why people, and then there's just some people who don't like the government, so they don't want to go on a government plan.
Okay, question.
Can you talk about Medicare negotiating drug prices and what changes you expect to see there?
I know that part of the changes with the drug companies with the cap at the $2,000, that certain drugs like Eliquis and Jardiance, those expensive ones, were supposed to be under review, but I don't think we're going to see those cost changes until 2027. So I haven't really been able to run a lot of comparisons for 2026 yet. Again, open enrollment doesn't happen until next week, so I can't say with the cost of drugs, but I can say not companies aren't going to cover every single drug. And if you were maybe paying nothing for your, atorvastatin, that's one of the drugs I see all day long, atorvastatin and levothyroxine. Those drugs are usually $0. You might start seeing a $5 or a $10 every time you pick it up at the pharmacy.
Getting back to my idea about the high deductible healthcare plans, I remember being in the corporate world at that time and saying, oh, I wonder how long these premiums will stay low. Well, that didn't last long. It wasn't probably 6 or 8 years that the high deductible healthcare plan premiums have ballooned to be very close to the other. So I don't know, but I have a hard time believing that Medicare Advantage plans can stay so low cost for so long.
I expected this year a lot of them to start charging $10 or $15 for a premium, and only one company actually went to the premium on their plan. Well, I mean, there's other plans out there that already had a premium, but one that only offers a premium plan. We do probably, maybe we'll see that in the next couple of years. Hopefully they're at least low premiums,
Another thing I'm hearing is that Wellmark wants no growth in their Medicare plans this year.
That is actually true that you brought that up. Actually, they have told us agents they do not want any new plans and they will not pay commission to us agents. And agents are not allowed to charge a fee to help customers. So if we move somebody to a Wellmark plan, we're pretty much working for free. So yeah, Wellmark does not, and they're not the only company. A lot of them are doing that. I don't like to talk money because we're not those kind of agents that, we're out to get the next commission. In fact, I'm not even a commission sales agent. I'm a salary employee. One of the reasons I came to work for Brenda and Lynn, we want to do what's best for the client. And if Wellmark is the best plan for you, we're still tell you about it. We don't want to charge you an outrageous amount just to make a commission, but they're going to be tough choices how to keep the lights on and keep everybody employed. So there's definitely, if you like having an agent and like having people to help you with your Medicare, we beg you to please talk to your legislators. Please tell them you need agents to help you with Medicare, that you cannot just start going to 1-800-Medicare or Medicare.gov to get this taken care of. But we have a feeling they're trying to push agents out the door, and we want to be here. We want to help clients. I love seeing the light bulb go on when I can help clients. If I can help somebody save, $1,000 on their drug, I go to sleep very well at night. But, we don't know what kind of changes are going to happen. But yes, Wellmark, Medicare, they've all said that they don't want any more business. And that's why sometimes they're pulling out of some counties here in Iowa.
Okay. Interesting times in this industry. Work with somebody. You have a choice in this. That's what I'd encourage you to do. And if you're not, find somebody that you do trust. So thank you. First of all,
Had one more question. They said,
question was, why would they not want more business?
yeah, why does Wellmark? They said they took on too much business last year for their Advantage plan, and they don't want customer service to go down. So Advantage plans are star rated, and their star rating, the more money they get from Medicare. If they start taking on more clients, their star rating could go down, which means they don't get more money from Medicare, which means it's tougher for them to give you the service that you deserve. So that we heard that from Wellmark and from United Healthcare.
I would say follow the money. That's usually an answer there. Okay. With that, first of all, thank you for coming.
Thank you.
Yes. Give
Thank you.
Christy a big round of applause.
Thank you. Thank you so much for having me.
Woo!
Woo, I know, so much
That's a lot
information.
going on.
So much
Okay.
information.
Thank you for coming. See you next month, November. Technology that you're going to encounter working with Compass. Have a great day.